This is my video presentation for diabetes. So first I'd like to say I would place two groups of diabetes. There's the chronic form of it, which includes diabetes type 1 and 2. And then there's other types such as gestational or pre-diabetes, which have more resolute endings than the chronic form. So type 1 diabetics, they have symptoms of severe thirst and hunger, and as well as type 2, because there isn't any sugar being broken down, the body is using fat and protein as fuel, so there will be presence of ketones in urine and the bloodstream. So the main differences between type 1 and type 2 is that type 1, the cells attack the insulin producing cells in the pancreas. So there is little to no insulin that's able to take that sugar in the bloodstream to other cells. And then in type 2, there is not enough insulin created to overcome, for whatever reason, the body's resistance to insulin. So again, there's not enough. For type 2 diabetes, people most likely to get it are Hispanic, Blacks, and Asians. And big factors are age. So a lot of people in their 40s and up get it, as well as weight, which plays a large factor as well, rather than type 1 diabetics who can get it from like passed down if a family member has it. So common symptoms or just kind of consequences of getting diabetes for type 2 diabetics. They have a greater risk of getting Alzheimer's or dementia. And for type 1 diabetics, family members can pass it down to them, and they're more likely to get nerve damage, especially in their legs, which is a big consequence, so to speak. So for type 2 diabetics, because it's chronic, there really isn't any cure, but things that can help dramatically are a change in diet as well as exercise, because weight plays a large factor as well for type 2 diabetics. And then for type 1 diabetics as well as type 2, getting insulin, more insulin, taking medication, and again, just overall paying attention to what you eat and exercise if you can.